sessions. And the first bill up is Delegate Adams with House Bill 1737.
Thank you, and good morning, Madam Chair, members of the committee.
Good morning.
House Bill 1737 would temporarily enact regulations that maintain the reduced postgraduate clinical experience requirement from 5 years to 2 years for a nurse practitioner to practice independently until July 1, 2022. Nurse practitioners in Virginia are highly qualified health professionals with extensive education and a very limited scope of practice. Decades of data show that nurse practitioners increase access in underserved areas, reduce costs, and improve health outcomes. Prior to the pandemic, Virginia stood alone with the most restrictive transition to practice in the country, ignoring data demonstrating an overwhelming consensus that 2 years is more than enough time for an independent practice. The governor initially lifted these non-safety related requirements in an effort to address the healthcare workforce shortage, the crisis during the pandemic. NPs have answered the call to fill gaps during this time of need. Taking the governor's orders, qualified NPs have created meaningful relationships with their patients and provided high quality care, oftentimes in communities where finding a provider would prove difficult or impossible. Right now, these critically important patient relationships are vulnerable because they are only permitted through the end of the state of emergency, which could end at any time. This puts patients and providers in a precarious position and could lead to significant disruptions in care, especially in underserved communities. Decades of data and experience from dozens of other states clearly demonstrates that a 2-year transition to practice for NPs is has significant benefits for population health and access to care in underserved communities. Some stakeholders have expressed an interest in reviewing additional information from an ongoing DHP study on nurse practitioners in the Commonwealth, which will be published this fall. And I understand that desire, but I would like to caution that this study is limited in scope and will not hold the answers people are seeking. However, in the interest of arriving at a consensus, this bill was modified to include an enactment clause that sunsets this legislation on July 1, 2022. This provides a clear timeline for patients and providers and allows us to give full consideration to the results of the study without disrupting care in the meantime. This is particularly important in rural and underserved areas across the Commonwealth where NPs have stepped up and created patient-provider relationships in areas where physicians are few and far between. Snatching away their ability to practice leaves patients in a lurch, especially when NPs are unable to find a physician for a practice agreement or must pay exorbitant fees to do so. This is a temporary measure and gives us time to have a complete conversation while continuing to keep patients first. Thank you, Madam Chair.
Thank you, Delegate Adams, for that presentation. And I see that there are several hands raised. I want to go to those who are in support of the bill first. I would turn to IT so that you can inform me of whom those individuals are.
First, we have Ashley Apple.
Ashley Apple, are you in the room?
Yes, I am. Can you hear me?
Yes, we can. Go right ahead. Thank you.
Good morning, Madam Chair and members of the committee. My name is Ashley Apple, and I'm a registered nurse and a family nurse practitioner. I'm speaking on behalf of the Virginia Nurses Association, which represents over 110,000 registered nurses in the Commonwealth, and we strongly support this bill. When we prescribe antibiotics to patients, the dosage and length of treatment isn't arbitrary. It's based on evidence that demonstrates patient safety and favorable outcomes. We should use the same measures for health policy. The current Virginia law mandating a 5-year practice agreement is arbitrary. It's much longer than the standard among the 28 other states that grant full practice authority, and there's no evidence to suggest that it improves patient safety or patient outcomes. In addition, it presents a barrier for access to care in medically underserved communities where some of our most vulnerable patients live and work. We humbly ask that you support this bill, and in doing so, ensure that all Virginians have access to the safe, high-quality care they deserve. Thank you.
Thank you. We have 2 minutes left for the remaining individuals in the queue who are in support, so you might want to abbreviate